World's largest cancer conference underway in Chicago. More than 40,000 cancer researchers, doctors, and company executives in attendance. Our Angelica Peebles joins us from the ground with a very special guest this morning. Morning, Angelica.
Morning, Carl. It is definitely buzzing here today, and part of that is some deal news that we have from Bristol Myers Squibb. Joining me now, CEO Chris Boerner. Chris, thank you so much for joining us today. You are announcing this massive partnership, up to $11 billion with Biontech for their experimental cancer drugs. So tell us about that deal. Why are you doing this, and why are you paying so much for this partnership?
Well, listen, we are thrilled to be announcing this partnership with Biontech. We think this could be the next new frontier in the treatment of cancer. When you look at the data that's been generated in this class of medicines across multiple companies, including Biontech, we think there's an opportunity to transform the outcomes for patients across a number of difficult-to-treat solid tumors like lung cancer and triple-negative breast cancer. And it's thrilling to be part of that. And it's also a nice synergy between these two companies. We think that the great science coming out of Biontech, we clearly know the IO space exceptionally well as a company. Put those two things together, we think we're a perfect partnership to translate this science to reality and give BMS another leg for growth as we exit this decade.
And talk to me a little bit more about the cost and what you're willing to pay, because we've seen this space has become such a hot area. You know, obviously we had Summits data last year that kind of sparked this buzz, and then we saw Pfizer just recently paying up to about $6 billion for theirs, and now you're here with $11 billion. So is this just a reflection of the excitement around this? Do you feel like it's worth that price tag?
Well, there certainly is a lot of excitement around this asset. Remember, we've been following this mechanism for a long time. We know this space well. And what do we see with this opportunity with Biontech? First, we see the opportunity across multiple relatively large tumor types where there's significant unmet need. It's helpful to step back and remember that while IO works very well today, only about 30% of patients are getting durable remissions. There's still a lot of unmet need in these big tumors. The second thing is we really like the science. You've got a bispecific that takes VEGF, marries it with PD-L1, and gets synergy between the two. We really like that. And third, we know how to commercialize products in this space. And what's nice about where Biontech is positioned, it's going to be first or second across multiple tumors. And what have we learned from our IO experience? If you want to capture value in highly competitive spaces like this, you need to be first or second. This deal gives us the ability to do that.
And I wonder, the timing is interesting because we just saw some new data from Summit on Friday that, a lot of people reacted negatively to it, and it made people question the whole validity of this area. So has that changed your thinking at all? Obviously, you announced the deal today, but do you still feel as good about it?
We feel great about it. In fact, we look at the totality of data when we look at a deal of this size, and certainly in this space. And what I'll tell you is when we look at even the data we saw last week, that was data in a very difficult to treat patient population. We know PD-1, PD-L1 as monotherapies don't work. And what did we see? We saw very strong PFS. We saw a trend towards overall survival. We saw a nice concordance between Asian and Western patients. Put those things together, we think it actually adds to the totality of data. And frankly, we believe it actually adds positively. And that's what we've heard from KOLs at this conference, in fact.